I want to talk about my thiazide diuretics. So your thiazide diuretics are one of the first line treatments for hypertension on top of your ACE inhibitors and your calcium channel blockers. So the way thiazide diuretics work is they act on the distal convoluted tubule and they prevent the sodium chloride co-transporter, which means that sodium and chloride are reabsorbed together. Sodium, chloride. By blocking that channel, what actually happens is there is increased levels of sodium in the tubule, and that's going to activate aldosterone because aldosterone is going to cause a reabsorption of sodium into the body and secretion of potassium. So what we see is increased action of aldosterone. Aldosterone increases epithelial sodium channel activity. Sodium channels get reabsorbed, potassium gets secreted. And one of the side effects of this medication is a hypokalemia, conversely to your ACE inhibitors and your angiotensin receptor blockers. Now, one of the other major symptoms of this drug is it can also cause a metabolic alkalosis. And it's the same principle in that now, since we have the secretion of potassium into the tubules due to the action of aldosterone, potassium gets swapped with the hydrogen exchanger in the collecting duct, and more hydrogen gets dumped into the collecting duct, and that causes a metabolic alkalosis. This medication is usually not used for people who are younger than 65 because it can also cause hypoglycemia. And the way this happens is, since we have hypokalemia, you have to think of the rest of the body has low potassium, and that includes, please don't mind the drawing of the pancreas, but the interstitium of the pancreas also has lower sodium. And so when you zoom to the cells that are actually releasing your insulin, it's your beta cells. And so now, since we have lower potassium in the interstitium, sodium channels, so potassium channels in particular, are going to stay open longer to cause the efflux of potassium out to try correcting this interstitial potassium imbalance. And as a result, positive potassium ions are moving out, and that's going to hyperpolarize beta cells. Thus, it makes them harder to depolarize and release insulin granules. So a decrease in insulin is going to cause an increase in glucose or hypoglycemia. And that is a nutshell of thiazide diuretics.